generally, we as a doctors, generally have a pattern that, we like to teach other people. We constantly teach people. Like, for example, you teach DNB students, you go to college and you teach the students there. And if not everything, you publish some papers. You do a lot of data collection, you publish some paper. The paper publication is not going to come back to you. You feel that somebody will read this paper some part of the world and then use what you have done, good work you have done in here. So developing with this, the days when we used to teach, when we used to do research work, all that is fine. But in the AI world, really, can we do some kind of similar thing and make it more enhanced, make it more better in this case? So I'll quote you a couple of examples what other doctors have done that will help you understand what best we can do when it comes to data and AI applications available. There is one doctor, Dr. Subhiah. He's an oncologist, a senior consultant oncologist in Royapeta Hospital, Chennai, and he is a very senior consultant. So what he was doing is, past 15 years, I don't know why, but he was storing all his patients' data in an Excel sheet. Every year he will open an Excel, start an Excel sheet, document all the patients and leave it. And every year he will open a new Excel sheet. In that Excel sheet, what he will do is, a patient has come, this is the grade of tumor, this is the chemotherapy cycles, number of cycles given, what was the prognosis, and the remaining pulse, BP, whatever is available, address, age, and all the demography and everything. Likewise, he's been storing all this data since close to 15 years. Now, if you go back and see the chemotherapy and the prognosis chart, if you could see, there is a match. So for the X patient, this chemotherapy, how is responded? The Y patient, chemotherapy, how is responded? Now you take all that data, put it to a machine learning and ask the machine to learn the entire data at once and then keep an application. Tomorrow, if somebody comes back to you, you can say, if so-and-so patient has come to you now with so much of grade of tumor, how much could be the right amount of chemotherapy cycles to be given and what could be the prognosis? So he can recommend you saying that the previously so-and-so has happened, the prognosis could be up to this level. Go back and think what this doctor has done. He has built his entire years of experience into data. Now tomorrow the doctor is not come for some reason to the hospital or is retired, God willing he is no more in the world, but the work he has contributed goes to the eternity. Even tomorrow if he is not there, people can use the same application to any part of the world, wherever it is. Use a classic example. Instead of using your data, doing it to a research work and publishing some paper somewhere, use it like an application. Keep it on the cloud. Access to multiple people, wherever it is, you are there, you are not there, people can use this application and go take it forward. Likewise, you've got n number of stories which you are building around everywhere. But my message to the doctor is, you continue the same job, but do it little more advanced, little more, think differently, think tangentially. The one challenge you will find here is getting a right machine learning guys. Obviously in India we don't get a good machine learning experts yet. Even I was struggling it and I was able to get some machine learning guys and I sent them to US, got them trained from Google DeepMind. I have to do a lot of activity because accuracy level varies from person to person. The person I do it and they do it and they do it. There is some technological disadvantage yet in the country, but if you have the data, we can definitely work it around. If you have not done it so far, start thinking in these lines. This will definitely help you and the community do better.
For more updates from CXO TV, please like and subscribe to our channel.